Hello and welcome to our webinar on counseling to prevent tobacco use. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects related to the Medicare Part B preventive service of counseling to prevent tobacco use. I have a few housekeeping items to go over with you before we start the webinar. You can find the link to the encore presentation of this webinar on our website's Training Center page at www.wpsgha.com, and it will be accessible for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist, and both should be available within the next 15 business days. If you have any questions, please put those questions into the chat, and we will answer questions as time permits. And should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterward. We really want your feedback. It helps us develop the education on topics you may be interested in. So consider taking the survey to let CMS know what you did like and what topics you'd like to learn more about. So Mary is going to place a link to the survey into the chat, and there will also be an opportunity at the end to take the survey. Additionally, if you're listening to this through the Encore, you can provide feedback by completing the survey or viewing that presentation. To access the survey, click on the circle with the eye on the upper right corner of the video. And a link to the survey can also be found in the description of the video. So on this next slide, we have our disclaimer. Medicare rules change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. These do take precedence over anything presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on the Training Center page on our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. So this slide contains the CPT copyright notice, and it is a requirement to be provided to you since we do have CPT codes within this presentation. So please review this information at your convenience. On this slide, you'll see a list of acronyms used in this presentation. If there are any acronyms you don't recognize while we're presenting, please consult this slide for clarification. So let's get started. Every November, on the third Thursday of the month, the American Cancer Society hosts the Great American Smokeout. This event raises awareness about the dangers of tobacco use and encourages individuals to quit for better health. Tobacco use is the leading cause of preventable disease and death in the United States. Quitting tobacco can significantly improve both a person's health and overall quality of life. Medicare Part B offers coverage for counseling to prevent tobacco use as part of its preventive services. Our objective for today is to provide an overview of the clinical aspects for the Medicare preventive service of counseling to prevent tobacco use. And we will cover health effects from tobacco use, benefits of tobacco cessation, treatment options for tobacco cessation, and the Medicare Part B coverage criteria for counseling to prevent tobacco use. So let's start with some key facts and statistics related to tobacco use and smoking. The CDC reports that an estimated 49.2 million adults in the United States, or about 1 in 5 adults, are current users of tobacco use or were current users of tobacco use in 2022. Every day, approximately 1,200 people die from diseases related to tobacco use. And each year, approximately 490,000 people die as a result of cigarette smoking and secondhand smoke exposure. According to the American Cancer Society, tobacco use is responsible for about 1/3 of all cancer deaths in the U.S. So now let's focus on the specific impacts of smoking on lung cancer and its effects on the effects of secondhand smoke. According to the CDC, smoking is responsible for 80 to 90% of all lung cancer cases. Per the American Lung Association, individuals diagnosed with the most common type of lung cancer, non-small cell lung cancer, experience poorer outcomes if exposed to secondhand smoke, including reduced overall survival and progression-free survival. Smoking doesn't just harm those who smoke, it also affects anyone exposed to the tobacco smoke. Secondhand smoke is responsible for approximately 41,000 deaths each year among non-smokers, and it causes over 7,300 lung cancer deaths annually in adults who do not smoke. Non-smokers exposed to secondhand smoke face an increased risk of lung cancer by 20 to 30%. So there's no safe level of exposure to secondhand smoke. Simply put, tobacco use and the harmful smoke it produces can impact anyone, regardless of whether they use tobacco or not. So what causes a person to become addicted to tobacco? Tobacco addiction is primarily caused by nicotine, a highly addictive stimulant found in all tobacco products. When a person uses tobacco, nicotine rapidly enters the bloodstream and travels to the brain where it activates the central nervous system, increasing the heart rate, blood pressure, and alertness. Once in the brain, nicotine stimulates the release of neurotransmitters. These neurotransmitters, such as dopamine and serotonin, can influence a person's mood and contribute to feelings of pleasure and reward associated with tobacco use. Dopamine, in particular, creates feelings of pleasure and satisfaction, which reinforces the desire to continue using tobacco. And this is why nicotine is so addictive. Nicotine creates a pleasurable sensation for the person with each use. However, this sensation is temporary, leading to the individual to smoke or use tobacco products again to maintain that feeling. As nicotine is used repetitively, the brain adapts to frequent nicotine exposure, requiring larger or more frequent doses to achieve the same effect or to avoid withdrawal symptoms such as irritability, anxiety, and strong cravings. This pattern contributes to long-term addiction and significantly affect a person's mood, behavior, and overall health. Nicotine is present in a variety of tobacco products, including cigarettes, cigars, vaping devices, including e-cigarettes, hookahs, chewing tobacco, snuff or dip, snus, and dissolvable tobacco products such as lozenges, strips, or sticks made from powdered tobacco. While anyone who uses tobacco can become dependent, certain factors can increase the likelihood of developing tobacco dependence. The first is age. Many individuals begin using tobacco products in their preteen or teenage years. The younger someone is when they begin smoking, the more likely they are to become addicted to tobacco. Next is being male. Men have traditionally been more likely to use tobacco products than women, although this gap has narrowed in recent years. Genetics and family history are the third risk factors. How a person's brain nerve cell receptors respond to levels of nicotine may be influenced by their genetics. Additionally, children raised in households where parents smoke are more likely to become smokers themselves. However, it is important to note that having these risk factors does not guarantee that someone will use tobacco. The fourth risk factor is race and ethnicity. Tobacco use rates are highest among non-Hispanic American Indians or Alaska Natives and lowest among non-Hispanic Asians. Next is mental health issues. Research has shown a connection between mental health conditions such as depression, schizophrenia, and post-traumatic stress disorder, and an increased likelihood of smoking or using tobacco products. The sixth risk factor is chronic stress or emotional distress. Chronic stress and emotional distress can increase a person's susceptibility to using tobacco. Many individuals use smoking or tobacco products as a way to manage stress, anxiety, or other challenging emotions. This often leads to a cycle where tobacco use becomes linked to relief from stress, which can make quitting more difficult. The next risk factor is substance use. There's a correlation between substance use, such as alcohol and illegal drugs, and an increased likelihood of smoking or using tobacco products. Finally, the last risk factor we will discuss is peer pressure. Those with friends or social circles who use tobacco are more likely to begin using it themselves. While these factors increase the risk of tobacco dependence, it's important to note that having one or more of them does not guarantee the person will become dependent on tobacco. Tobacco use impacts nearly every organ in the body. It poses a serious health risk, greatly raising the chances of developing a variety of health disorders and diseases. Individuals who use tobacco face a higher likelihood of developing cardiovascular issues such as coronary heart disease, atherosclerosis, dyslipidemia, aortic aneurysms, myocardial infarctions, cerebral vascular accidents, increased blood pressure, peripheral vascular disease, diminished blood flow, poor wound healing, and blood clots, respiratory issues and lung diseases, including chronic obstructive pulmonary disease and worsening of asthma, as well as increased susceptibility to developing respiratory infections such as colds, flu, bronchitis, pneumonia, and tuberculosis, cancers of the mouth, pharynx, esophagus, larynx, lung, kidney, bladder, liver, pancreas, stomach, cervix, colon, and rectum, as well as acute myeloid leukemia, musculoskeletal issues including osteoporosis and rheumatoid arthritis, reproductive issues such as impaired fertility and impotence, as well as increased potential for complications during pregnancy, sensory issues such as cataracts, age-related macular degeneration, tooth and gum disease, and a diminished ability to taste or smell, type 2 diabetes, impairment of the immune system, and wrinkling of the skin. Exposure to secondhand smoke can cause health issues in non-smokers, including coronary heart disease, lung cancer, lung damage, cerebral vascular accidents, and irritation of the nose, throat, eyes, sinuses, and lower respiratory tract. Children exposed to secondhand smoke are at a higher risk for worsening asthma, more frequent ear infections, and increased risk of sudden infant death syndrome. So what happens when someone suddenly stops smoking, commonly referred to as quitting cold turkey? The person will typically go through nicotine withdrawal as a result. This can cause a range of withdrawal symptoms such as strong cravings to smoke, feeling irritable or grumpy, feeling uneasy, fidgety, or restless, anxiety or depression, difficulty in concentrating, insomnia or sleeplessness, hunger, and weight gain. Fortunately, these withdrawal symptoms usually decrease and eventually fade as long as the person stays smoke-free. Quitting tobacco offers numerous health benefits, including significantly lower risk of developing a wide range of serious medical conditions. The American Lung Association reports after 1 to 2 years, the risk of myocardial infections decreases. After 5 to 10 years, the risk of cancers of the mouth, pharynx, and larynx decreases by 50%, and the risk of cerebrovascular accidents decreases. After 10 years, the risk of cancers of the esophagus, bladder, and kidney decreases. After 10 to 15 years, the risk of lung cancer for someone who has quit smoking is reduced to half of that of a current smoker. And after 15 years, the risk of coronary heart disease for someone who has quit smoking approaches that of a non-smoker. Other health effects following quitting include reduced risk of abdominal aortic aneurysm and a potential decrease in the risk of atrial fibrillation, sudden cardiac death, heart failure, venous thromboembolism, and peripheral arterial disease. Additionally, quitting smoking often leads to improved sense of taste and smell, along with a significant increase in life expectancy due to the decreased risk of smoking-related illnesses. During a routine physical exam, healthcare providers can often detect signs of tobacco use in patients. This is typically identified when documenting the patient's medical or health history. It's important to assess tobacco use in all patients when taking their health history, regardless of whether they show specific risk factors. Providers can gather this information through methods such as patient interviews, screening tools or questionnaires, reviewing medical records, or a combination of these approaches. Once tobacco use is confirmed, healthcare providers can work with the patient to develop a personalized plan that helps them quit smoking or using tobacco products. Treatment options can include behavioral counseling, educational support, and medications to help with tobacco cessation. Often, a combination of these methods is used. Behavioral counseling and education can be delivered by a physician or other qualified non-physician practitioner, and this may include one-to-one or group counseling sessions, as well as support groups aimed on tobacco cessation and behavioral counseling. These services can be offered both in community settings and in clinical environments. Tobacco cessation medications may help reduce the urge of tobacco products. They can be used on their own or in conjunction with other treatment options. The FDA-approved treatments for adult tobacco use dependence include over-the-counter nicotine replacement therapy products such as transdermal patches, gum and lozenges, prescription nicotine replacement therapy products such as nasal sprays and inhalers, and prescription pills such as bupropion and generic versions of varenicline. Nicotine replacement therapy provides a partial substitute for nicotine previously obtained from tobacco products, helping to reduce discomfort after quitting. Bupropion assists with reducing cravings and alleviating other nicotine withdrawal symptoms. Varenicline mimics some of the effects of nicotine on the brain, helping to decrease cravings and withdrawal symptoms, while also reducing the pleasure derived from smoking cigarettes. Studies indicate that people who combine counseling with tobacco cessation medications have a higher success of quitting smoking. Regarding coverage, Medicare Part D typically covers prescription replacement therapies such as nasal sprays and inhalers, as well as prescription pills like bupropion and generic varenicline, when prescribed by a doctor for smoking cessation. To receive coverage for these prescription drugs, the patient must be enrolled in a Medicare Part D plan. However, Medicare does not cover over-the-counter medications or stop smoking aids such as nicotine gum. Please note that coverage may vary depending on the specific Medicare Part D plan the patient has, so it's important to verify the details of the patient's individual prescription plan first. Medicare Part B beneficiaries who use tobacco products are eligible for counseling to prevent tobacco use as long as they meet certain criteria, and we'll discuss the Medicare coverage criteria in a little bit. Healthcare providers may decide to gear their counseling sessions to align with the 5 A's approach outlined by the United States Preventive Services Task Force of assess, ask about, assess behavioral health risks and factors affecting choice behavior, change goals, and methods, advise, give clear, specific, and personalized behavior change advice, including information about personal health harms and benefits, agree, collaboratively select appropriate treatment goals and methods based on the patient's interest in and willingness to change the behavior, and assist, using behavior change techniques, self-help and/or counseling, aid the patient in achieving agreed-upon goals by acquiring the skills, confidence, and social and environmental supports for behavior change, supplemented by adjunctive medical treatment when appropriate. When applying the 5 A's approach to counseling for tobacco use cessation, providers might find it useful to consider the following as suggested by the USPSTF. Ask about the patient's tobacco use, including the types of products they use, the frequency of use, and duration of use. Offer personalized guidance based on the patient's specific situation to help them quit using tobacco products. Evaluate the patient's readiness to engage in tobacco cessation and willingness to quit. Offer support and assistance to the patient to help them quit tobacco use, including referrals to tobacco cessation resources within the community, and schedule follow-up and additional support as needed. The USPSTF also recommends treating smoking status as a vital sign and documenting it at every healthcare visit to monitor tobacco use. A link to the USPSTF's behavioral counseling interventions and evidence-based approach will be placed in the chat. The information about the 5 A's is halfway down on the page. There are additional strategies a person can implement to help quit tobacco use and alleviate withdrawal symptoms. The first strategy is getting regular physical activity or exercise. Exercise helps reduce nicotine cravings and withdrawal symptoms by releasing endorphins. Endorphins are natural mood boosters that can alleviate stress, anxiety, and irritability commonly experienced during quitting. Physical activity also improves overall cardiovascular health and lung function, helping to repair some of the damage caused by smoking. The CDC recommends adults get 150 minutes of moderate intensity physical activity per week, as well as 2 days of muscle strengthening activity per week. Incorporating exercise into daily routines can also distract from urges to smoke, provide a healthy outlet for stress relief, and contribute to better sleep patterns. Additionally, regular physical activity supports weight management, which can be particularly helpful since some people experience weight gain after quitting tobacco. Next is maintaining a well-balanced diet and including healthy, low-calorie snacks when needed. For certain individuals, quitting smoking may trigger stress-related eating. Adopting healthy eating habits can help with managing hunger and stress-related eating while also helping to prevent excess weight gain. Staying well hydrated by drinking no-calorie or low-calorie beverages is the third strategy. Encourage patients to choose decaffeinated beverages when possible to help minimize feelings of jitteriness and restlessness. Additionally, encourage patients to avoid drinks that they associate with tobacco use, such as coffee or alcohol. The fourth strategy is obtaining support from family, friends, or an online support group. Emotional encouragement and understanding from others can provide motivation and accountability. Joining online support groups or forums allow individuals to connect with others who are going through similar experiences, share tips, and receive advice around the clock. This network of support can help reduce feelings of isolation, boost confidence, and increase the chances of successfully quitting tobacco. Another strategy is practicing relaxation techniques such as deep breathing, muscle relaxation, yoga, or massage. Techniques such as deep breathing can help calm the nervous system, reduce anxiety, and produce a quick way to manage cravings when they arise. Progressive muscle relaxation involves systematically tensing and then relaxing different muscle groups, which can relieve physical tension caused by stress or nicotine withdrawal. Yoga combines physical movement, breathing exercises, and mindfulness to promote overall mental and physical well-being, helping to reduce stress and improve mood. Massage therapy can also be beneficial by alleviating muscle tension, lowering stress hormone levels, and encouraging relaxation. Incorporating these practices regularly can help support emotional balance, decrease irritability, and enhance the ability to cope with challenges of quitting smoking. Exploring alternative medicine techniques such as meditation, hypnosis, and acupuncture is a sixth strategy. Meditation involves focused attention and mindfulness practices that help calm the mind, reduce anxiety, and increase awareness of cravings without reacting to them, making it easier to resist urges to smoke. Hypnosis is a therapeutic technique that aims to change subconscious thought patterns related to tobacco use, helping to reduce cravings and reinforce motivation to quit. Some people find hypnosis useful for managing withdrawal symptoms and improving self-control. Acupuncture involves stimulating specific points on the body with fine needles. It's believed to help reduce nicotine withdrawal symptoms, alleviate stress, and restore balance in the body's energy, potentially making quitting easier. While research on the effectiveness of these techniques varies, many individuals find them helpful as complementary strategies alongside conventional treatments such as counseling and medications. Incorporating alternative approaches can enhance relaxation, reduce anxiety, and support a holistic approach to tobacco cessation. The next strategy is offering alternative options such as sugar-free gum, sugar-free hard candies, nuts, or crunchy vegetables as substitutes for tobacco products. These alternatives help reduce the reliance on tobacco by addressing both the physical and behavioral aspects of addiction. They can also help manage stress and anxiety, which are common triggers for tobacco use, by offering a healthier way to cope with cravings. Another strategy is to avoid triggers that may entice them to relapse or start using tobacco products again. Triggers can be situations, places, people, emotions, or routines that the person associates with tobacco use and that prompts cravings. Common triggers may include social gatherings where others are smoking or drinking alcohol, stressful situations, or certain daily habits like having coffee, as well as exposure to environmental cues such as seeing tobacco advertisements or smoking-related imagery. Having these personal triggers and identifying them early on helps the individual prepare and develop strategies to manage and avoid them effectively. This may involve changing routines, such as taking a different route to work to avoid passing by places associated with smoking, or avoiding social settings where tobacco use is common. Planning ahead for high-risk situations like parties or work breaks by having alternatives ready or practicing refusal skills can help reduce the risk of relapse. Ultimately, avoiding or managing triggers strengthens a person's ability to stay smoke-free and supports long-term success in quitting tobacco. The final strategy we will discuss is celebrating the milestones achieved along the journey to quitting. Recognizing and acknowledging progress, whether it's 1 day, 1 week, 1 month, or longer without tobacco, helps reinforce positive behavior and boost confidence. Encourage patients to set specific goals and mark each accomplishment with a meaningful reward or celebration, such as treating themselves to a favorite activity, buying something special, or spending time with loved ones. Celebrating successes also helps shift focus away from the challenges of quitting and toward the benefits they're gaining, like improved health, increased energy, and financial savings. Rewarding oneself for quitting milestones makes the process feel more positive, manageable, and empowering, which encourages continued commitment to a tobacco-free life. Additionally, there are several community resources available to support individuals who are trying to quit tobacco use. These include calling a smoking quit line, such as 1-800-QUIT-NOW, which connects callers to free support and counseling services, visiting the website smokefree.gov, which offers a wide range of tools and support to assist with tobacco cessation, using the National Cancer Institute's smokefree.gov resources, which offers support through a variety of tools, including a quit smoking app, text message program, and live chat with quit counselors. These resources provide ongoing support for individuals working to quit tobacco. Users can download the Quick Start app to their smartphones for personalized tips, progress tracking, and encouragement. They can also text QUIT to 47848 to receive daily motivational messages. Additionally, smokers can connect with a trained quit smoking counselor through the live help online chat service. And finally, participating in the Great American Smokeout, an annual event hosted by the American Cancer Society. This event takes place on the third Thursday of November. This year, that date falls on November 20th. The event encourages smokers to take the final step toward quitting and provides resources and support to help them succeed. Now that we've reviewed treatment options and available support for tobacco cessation, let's discuss Medicare's coverage criteria for counseling to prevent tobacco use. Medicare covers counseling to prevent tobacco use for outpatient and hospitalized patients enrolled in Medicare Part B, provided they meet the following criteria. The patient uses tobacco, regardless of whether they exhibit signs or symptoms of tobacco-related disease. The patient is competent and alert during the time of counseling, and the counseling was provided by a qualified physician or other Medicare recognized practitioner, such as those defined as eligible professionals in MLN 1986542 Medicare and mental health coverage. And a link to that resource will be placed in the chat. Medicare covers up to 2 individual tobacco cessation counseling attempts per year. Each attempt may include up to 4 sessions of either intermediate or intensive counseling, for a total of up to 8 sessions per year per patient. For each attempt, the healthcare provider and the patient may choose between intermediate sessions lasting more than 3 minutes but less than 10 minutes, or intensive sessions lasting more than 10 minutes. Providers should bill either 99406 or 99407, depending on which counseling session option they choose. There is no copayment, coinsurance, or deductible as long as the counseling to prevent tobacco use is performed by a healthcare provider who accepts assignment. Medicare does not require a referral for tobacco cessation counseling. However, to qualify for coverage, patients must meet the criteria of being tobacco users, regardless of whether they exhibit signs of tobacco-related disease, be alert and competent during the counseling, and receive the service from a qualified physician or other Medicare recognized provider. Counseling to prevent tobacco use is telehealth eligible. The requirement can be met through audio-only interaction. It's important to note that inpatient hospital stays solely for the treatment of tobacco use disorder are not considered reasonable or necessary for delivering tobacco cessation counseling. Therefore, tobacco cessation services are not covered in these situations. Finally, patients who have completed counseling for tobacco use in the past but have resumed smoking are still eligible to participate in Medicare's preventive counseling service to prevent tobacco use. Medicare allows two cessation attempts within a 12-month period, enabling individuals to receive counseling again if they previously tried to quit and relapse, provided they meet the eligibility criteria. So before we move on, I do want to address two pre-submitted questions we received. The first question asks, does a patient need to provide consent? And if yes, does it need to be verbal or written? Consent from the patient should be obtained prior to initiating this service. For Medicare's counseling to prevent tobacco use, the patient does not need to provide written consent. Verbal consent is sufficient. The next question asks, can a pharmacist perform the counseling under the supervision of a physician and bill under the physician? A pharmacist may provide counseling for tobacco cessation under the supervision of a physician and bill for these services using the Incident to billing rule, as long as the services fall within the pharmacist's scope of practice and all required conditions are met. These conditions require that the physician perform the initial patient evaluation and remain available to provide direct supervision while the pharmacist conducts subsequent counseling. The service is then billed as an incident to the physician's services using the physician's NPI or National Provider Identifier on the claim. Documentation requirements for counseling to prevent tobacco use include date service was provided, office visit notes for the date of service, including documentation of the patient's verbal consent, patient's tobacco status, counseling was offered and accepted, and number and duration of sessions provided. Additionally, documentation needed includes documentation of the counseling intervention was provided by a qualified physician or other Medicare recognized practitioner, and documentation to support the medical necessity of counseling to prevent tobacco use, including noting patient currently uses tobacco, regardless of whether they exhibit signs or symptoms of tobacco-related disease, and the patient is competent and alert at the time of counseling. All documentation should be dated and signed with the provider's credentials. Prior to completion of counseling to prevent tobacco use, ensure the patient has met the eligibility and frequency criteria for this preventive service. Tobacco use remains the leading cause of preventable illness and death in the United States. Quitting tobacco can lead to major improvements in both the health and quality of life. As part of its preventive services benefit, Medicare Part B covers counseling to help individuals quit tobacco use. So as a recap, during today's webinar, we explored health effects from tobacco use, reviewed benefits of tobacco cessation, discussed treatment options for tobacco cessation, and reviewed coverage criteria for the Medicare Part B preventive service of counseling to prevent tobacco use. This slide includes several helpful resources. The first link directs you to CMS's Medicare Preventive Services chart, which offers guidance on coverage for counseling to prevent tobacco use. The next link leads to the National Coverage Determination, NCD 210.4.1, which explains the coverage policies and eligibility criteria for tobacco use counseling services. It offers detailed guidance on the requirements that must be met for these services to be reimbursed under Medicare. I've also included links to the Medicare Claims Processing Manual and the U.S. Preventive Services Task Force section on tobacco smoking cessation in adults. The final link is to the Encore Presentations playlist on our YouTube channel. Please refer to this slide when viewing the presentation. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. And if we don't get your questions today during the presentation, we will send out a document to all participants with the answers following this webinar. So I am just going to review the chat real quick. And I do not see any questions in the chat. But if you do have any questions, feel free to put it in the chat, and I'll look at that one more time before we go to finish up the webinar. For those attending today's live event, in a few minutes, you will receive an email thanking you for attending. And the email will look like sort of what you see on this left-hand side of your screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as a link to take the survey. And if you haven't completed already, please take a few moments to complete the customer satisfaction survey. The contact hours for this event can be found in this email should you require them for continuing credit to our continuing education units. If you don't see it, please check your junk or spam folder. And make sure to add the WebEx email address at messenger@webex.com to your safe sender safe receiver list to avoid these emails going to junk and spam. And you can see right here, I think on the bottom here, I'll have it right here. If you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. Following this live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put counseling to prevent tobacco use in the subject line. And for those who have the presentation, it is hyperlinked right here. So you can just click that and it'll put the subject line into that email. However, if you have claim-specific questions, please do not send those to provider outreach and education. Please direct those questions to our customer service department, as we do not have access to your claim information and therefore unable to look up claims. Also remember, we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us about your experience, including what you liked, what we could do to improve, and suggestions for future education. Your feedback really is invaluable in helping us deliver the education you need. We use your feedback to develop topics for future education events. So there are several different options you can use to take the survey, depending on your preference. For those attending today's live event, the first option is to click on the survey link in the chat. The other option is to take the survey in the CMS Qualtrics page. So when you exit this webinar, you'll be asked to go to an external site and you'll get a pop-up when you do close. And that external site is that CMS Qualtrics page for the survey. And that pop-up looks like right here, what you see here with that little yellow triangle. That site is not spam. It's actually directing you straight to our survey. And we will also add a survey link to the Encore presentation. Just click on the survey picture at the end of the Encore presentation video to take our customer satisfaction survey. Based on your feedback, we've added several enhanced features to improve your educational experience. Our Encore presentations videos now include chapters, making it easier for you to find key information quickly. We've also introduced training indicators during the webinar registration to help you identify the attended audience for each session. So it might say Part B, it might say NTM, which means new to Medicare, CLN for clinical, bill if it's a billing webinar, and hopefully that should help you identify which webinars will suit your needs. So we're hoping these enhancements will make your learning experience more valuable and accessible. And I'm just going to quickly take a look at the chat one more time. I do not see any questions, so I am going to move on to finishing up the webinar. So on behalf of myself, Mary, and all of Provider Outreach and Education, thank you for attending today's webinar on counseling to prevent tobacco use. As a reminder, this presentation will be posted as an Encore presentation on our Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.